Hello, I'm Francesca Whitworth and welcome to my presentation about human immunity. The aim of my presentation is to gain a specific understanding of non-specific defences against disease covering the first, second and third lines of defence, and also to gain an understanding of specific immunity and the biology of vaccination. So before we investigate the body's defence against disease, we need to examine the organisms that cause disease and their methods of transmission. So what is an infection? This is when the body is invaded by microorganisms such as bacteria, viruses and parasites that are not normally within the human body. They can remain localised to the region they enter the body, but can also multiply and affect the whole body. Not all infections are easy to identify and they don't always cause symptoms. The four main causes of infectious diseases are bacteria, viruses, fungi and parasites. Bacteria are single-celled organisms responsible for illnesses such as strep throat, urinary tract infections and tuberculosis. Viruses are smaller than bacteria and not technically alive themselves and rely on finding a host for reproduction. They cause many diseases ranging from the common cold to HIV. Fungi is responsible for surface skin diseases such as athlete's foot and ringworm, can also cause infections to the lungs or to the nervous system. Parasites can cause illnesses such as malaria transmitted by a mosquito bite and can be transmitted to humans from animal feces. There are different methods of transmission through direct and indirect contact. Direct contact with a person or animal that is a carrier for an infection is one of the easiest ways to contract an infectious disease. The three ways of infectious disease can be spread by person to person, through coughing, touching, kissing, sneezing and through sexual contact. The person carrying the disease may not know that they have the infection or they might not show any symptoms. Animal to person, when a person is scratched or bitten by an infected animal. So animals from the wild, farm or pet, these could all be potential carriers. Another example of transfer of disease from animal to human could be through a person coming into contact with animal feces or urine. Mother to unborn child, this can happen if a pregnant woman has an infection which can be passed through the umbilical cord to the unborn baby. Or indirect contact, this can occur when an infected person touches an object that a non-infected person later touches, such as a door handle. For example, if you were to sneeze into your hand and then open the door, this will leave the germs on the door handle. The next person that goes to open the door will touch the handle and become infected. Other common transfer methods can be through insect bites, contaminated food or water. The body has three lines of defence. The first two are non-specific and the third is a specific response. Non-specific defences are those that do not distinguish between one type of pathogen to another, but they show the same response to all pathogens in the same way. The first line of defence has a range of physical and chemical barriers that prevent entry of pathogens. Looking at the skin's structure, the skin forms part of a system called the integumentary system that has three layers. The epidermis, the outer layer that provides a mechanical barrier against the external environment, has a waterproof coating to protect it from infectious agents and toxins and produces new skin cells that rise to the surface every 28 days. The epidermis also produces a substance called melanin that gives the skin its colour and protects it from getting burnt from the sun's ultraviolet rays. The dermis, this lies underneath the epidermis, containing the subaqueous gland, arterial blood supply and sweat glands. So the subcutaneous layer, this forms the deepest section containing connective tissues and fat. As long as the skin remains unbroken, it provides the function of being the body's first line of defence. So mucous membranes. Mucous membranes line the surface of cavities and organs such as gestational tract, respiratory tract, urogenital tract and the vaginal tract and protect open passageways into the body. They also prevent infectious agents such as pathogens and allergens from invading the body whilst letting good nutrients through, enabling the body to maintain a healthy body. The second line of defence has a range of non-specific responses. An injury to the skin or infection will normally cause an inflammatory response. Collection of cellular events and a major component of the immune system's response to damage or infection. When the body detects an intruder such as a pathogen or an irritant, it creates a biological response with the immune system to try to remove it. Blood circulation creates around the infected area, resulting in inflammation. The cell walls in the cells surrounding the infected area create gaps, allowing the immune response blood cells to pass through. There will also be an increased rise in body heat in the area of infection, which itself can have an antibiotic effect. The main symptoms of inflammatory response can be that the tissues in the infected area will become red in colour, they'll be warm to touch, swollen and painful, causing mechanical pressure on the nerve cells. When an inflammatory response has begun, it will continue until the underlying infection has healed. I'm now going to talk about the third line of defence and discuss pathogens and antigens. A pathogen is a microbe that causes an immune response and disease. They can be bacteria, virus, protozoans and fungi. Any infection that is too small to be seen by the naked eye is termed as a pathogen. Antigens are part of the pathogen that tell your body it is being attacked and cause an immune response in the body. Antigens can be any type of molecule such as a protein, carbohydrate, nucleic acid or fat. An example of an antigen would be a protein on a virus such as influenza. Acquired immunity. What is acquired immunity? People aren't born with acquired immunity, but it is learnt. When a person is exposed to the environment, the body's immune system encounters antigens. It detects and develops a memory for that antigen. It is also known as a specific immunity or natural immunity. Artificial immunity is when the human intervention is required to help target and destroy the attacking agent. Vaccinations can be used to give the body the required immunity to do this. Artificially acquired immunity is different because it involves some form of human intervention, unlike natural immunity that entails exposure of the body to a pathogen without any human intervention. The body's immune system starts to fight the disease-causing agent, and after protecting against the antigen, the body creates a memory of the agent, enabling natural acquired immunity. So immune system cells. We're now going to discuss key cells of the immune system. Leukocytes, also known as white blood cells, are the key element of the immune system involved in defending the body against infections. They are not single celled, but there are 5 different types which are all produced in the bone marrow. These are neutrophils, lymphocytes, monocytes, eosinophils and basophils. Neutrophils are the most common type of white blood cells. They're medium in size with irregular nuclei and many granules that perform a number of different functions. They attach to the blood vessels, blocking germs to the bloodstream, and are the first cells that reach the infected area of the body, acting in a process called phagocytosis. Lymphocytes have 2 small lymphocytes, the T cells and B cells. They are small and round cells with large nucleus located within a small amount of cytoplasm. They play a major role in the immune system related to antibody production. Monocytes are the largest of the white blood cells, giving them the ability to digest large particles in a wound. They are less common than the first 2 types, and they are agranulocytes, and they turn into macrophages when they leave the bloodstream. Eosinophils, these types of cells are rare in the bloodstream. They have large granules that help the cellular functions and are important cells in regards to allergies and worm infections. They release toxins from their granules, killing pathogens and parasites. High counts of this cell are associated with allergic reactions. Biosinophils are the rarest of white blood cells and contain large granules. Biophils produce anticoagulants and antibodies that act against hypersensitivity reactions in the bloodstream. They act against foreign invaders immediately and contain histamine. So the acquired immune system is responsible for the destruction of pathogens once they enter the body. On the first exposure of a pathogen, an acquired immune system learns how to attack and destroy it. Before encountering infections, they're ineffective, but once it creates a response, a protective response can be made more quickly, allowing it to protect the body from harm using the B and T cells. T cells are quite common. They mature in the thymus gland, and there are 3 different types: cytotoxic, suppressor and helper T cells. Their function is to release substances into the blood and signaling the growth to activation of the B cells. B cells produce antibodies and present antigens to T cells and provide signals for T cells to activate. So immunoglobulins, so these are known as antibodies and are proteins bound to antigens. Antibodies are used to target infection, recruitment of immune cells, neutralization of toxins and removal of antigens, also complement activation. They have two identical light chains and two identical heavy chains. These are arranged in a Y-shaped configuration. There are 5 types of immunoglobulins. IgG is the main and only type that is transferred across the placenta from the mother to the fetus, providing the unborn with some protection against disease that they haven't been exposed to yet. IgA protects the mucosal surfaces of the body, such as the mouth, lungs, throat, and without this, it can cause harm and major infections. IgM has different structures to the others. It has 5 normal immunoglobulins joined at their bases, and it is the first one synthesized in an antibody response. Ig is the largest and is the only one that's present in low levels of a healthy person. IgD, an uncommon molecule, and this is thought to function as an antigen receptor on the surfaces of B cells. So self-recognition and tolerance to own tissues. Antigens allow the immune system to distinguish self and non-self. Only non-self can be attacked. There are 2 important factors that can do this. The major histocompatibility complexes 1 and 2, known as MHC1 and MHC2, and the leukocyte antigen gene complex. Human cells display antigens that the immune system recognises as self and deals with them accordingly. When the immune system encounters an antigen of a red blood cell on its surface, it doesn't attack and is recognised as self. But when it encounters an antigen that it hasn't seen before, it will recognise as a non-self and this will respond to it. MHC1 and MHC2 both are expressed on the surface of all nucleated cells, acting as an early warning sign to the immune system. So what is transplantation? It is the act of transferring cells, tissue and organs from one site to another, for example from person to person, and is done to correct the malfunction of an organ system such as a heart, liver, lung or kidney, replacing the damaged organ with a healthy one from a donor. When a person receives an organ donation, their immune system may recognise it as foreign and recognises it as being non-self, causing rejection of the organ. There are 3 types of rejection. Hyperacute rejection. This happens a few minutes after the transplant when the antigens are completely unmatched. The tissues must be removed straight away before the recipient could die. Acute rejection. This can happen from 1 week to up to 3 months after transplant. All recipients have some amount of acute rejection. Chronic rejection can happen over many years when the body's immune response against the new organ slowly damages the transplanted tissues or organs. What is autoimmune disease? So the body's immune response and system protects from disease and infection. Where a person's immune system mistakenly attacks healthy cells in the body. They are wide-ranging they affect most parts of the body, although the cause is still unknown. It's thought that some triggers are bacteria, viruses, drugs or chemical irritants. The classic signs of autoimmune disease is inflammation. The most common organs and tissues affected are the joints, muscles, skin, red blood cells, blood vessels, connective tissues and endocrine glands. Symptoms can be improved by eating a healthy, balanced diet, exercise, rest and decreasing stress levels. So 2 examples of autoimmune disease are rheumatoid arthritis. This is a long-term condition. It can cause pain, stiffness in the joints and swelling, normally affecting hands and feet and wrists. The condition's caused when the immune system attacks the cells that line the joints and by mistake making them painful. There is no cure for it, but it can be managed by taking medicine, physiotherapy or surgery. Lupus. So this is also a long-term condition causing joint pain, extreme tiredness, skin rashes on the nose and cheeks. It can also cause complications in pregnancy. The causes of lupus are not fully understood and there is no cure. Symptoms of this condition can improve if treatment is started early by taking anti-inflammatory medicines, hydroxychloroquine for the joints and steroid tablets. It is also known as systemic lupus erythematosus and it's not easy to diagnose. So acquired immunity is split into active immunity and passive immunity. There are 2 types of active immunity. Active natural immunity develops when exposed to a pathogen that causes a specific disease, enters the body and begins to mount an immune response to try and attack the pathogen. Active artificially induced immunity is when an individual is artificially and intentionally exposed to foreign antigens to generate a protective immune response and carried out by having vaccinations. Looking at passive immunity now. Natural passive immunity is when antibodies are transferred from one person to another naturally. This can occur during pregnancy when antibodies are passed from the maternal blood to the fetal bloodstream. Artificially induced passive immunity is protection acquired by giving a person an injection or a transfusion of antibodies made by somebody else. What is a vaccination? This is when the body's immune system is exposed to a weakened version of the pathogen in order to stimulate white blood cells. This produces antibodies giving immunity against a specific pathogen. The vaccine only contains a weakened version of the pathogen. If the person later becomes infected with the pathogen, the white blood cells are able to produce and destroy it, known as immunological memory. This is when the immune system responds to a pathogen that has been previously encountered quicker than the first encounter. Primary response is a pathogen that's encountered for the first time. Memory cells are produced which enable them to recognise the same pathogen if encountered for a second time. Secondary immune response occurs if the same pathogen is encountered for the second time. Memory cells recognise it and reproduce higher amounts of the antibodies more quickly to fight the infection. So, benefits of infections. Immunisation and vaccines help to protect against serious disease. Viral disease cannot be cured by antibiotics, can only be controlled by vaccination. Vaccination programmes have helped diseases such as smallpox in 1979 to become completely eradicated. Before vaccines, childhood deaths were more common due to diseases such as measles, whooping cough and polio. By having vaccinations, it provides protection against serious complications that can arise from these infections that still exist. Looking at the measles statistic in England and Wales from 1940 to 2020, it shows that in 1940 there were 409,521 notifications of measles, with 857 deaths, compared to the year of 2020 that had 698 notifications and 1 death. Measles was first vaccinated in the UK in the late 1960s with the introduction of the MMR vaccine in 1968. Since the measles vaccines was introduced in 1968, Public Health England estimated 20,000 million cases, 4,500 deaths have been averted in the UK. So what is herd immunity? Herd immunity is when a high percentage of the population is immune to a virus or disease. It is known as community immunity. For example, if someone with the measles is surrounded by people who are vaccinated against measles, the disease will not spread easily and will quickly disappear without a widespread effect. Herd immunity can effectively stop the spread of some diseases, so it's important to protect ourselves and vulnerable people. Many vaccination programmes exist in the UK and now are accessible to adults and children. The NHS provide vaccine programmes to ensure people receive the best protection against viruses and diseases, starting from 8 weeks old upwards and carried out by doctors and healthcare professionals. They can provide extra vaccines for people who are at more risk, such as babies and anyone with an underlying health condition. The seasonal variability and presence of any infectious disease such as norovirus, flu and bronchitis. These infectious diseases can be very serious for certain age groups. Therefore, if vaccine is available for a certain disease, vaccinations will be part of an effective method of controlling the widespread of diseases and their effects on the population. Thank you for listening to my presentation.